Very good afternoon. Thank you all for joining us. Welcome to our interactive Facebook live session with Dr. Perungo, consultant,
Hello.
Bariatric Metabolic Surgery, and Ms. Reshma Aleen, senior dietitian. In today's discussion, our expert will give you insight of various causes of obesity and different health issues that are caused by it. Our doctors will clarify the fine lines that differentiate obese and overweight. So stick with us till end to find your answer of all your questions. Share this live link with more people to spread awareness. Hello doctor,
Hello.
welcome for coming for the live session. Doctors, we have some few questions. What are the leading causes of obesity?
Today we are just unaware of this demon. Okay, it is the new age demon which we are coming across. We are taking it very lightly. So obesity basically is a lifestyle disease. Whatever we do in the day-to-day life, that is reflecting in our body as a weight gain or excess weight. So the diet pattern which we are following nowadays, the activity and the lifestyle which have come down drastically. So it's more towards brainstorming work rather than a physical work. So the physical activity has come down, and exactly opposite what is happening to the diet pattern is we are taking a lot of junk foods and high calorie foods, which is adding on to the weight gain. So these are the two main causes of obesity. Apart from this, there are some genetic factors and hormonal factors. But the point to stress is, many people are of the opinion that this thyroid is the reason for obesity, but that is not actually correct. So somebody who is having hypothyroidism need not be obese. That is not the reason for obesity. And there are also myths like after cesarean section or after childbirth, they are putting on weight, but that reflects their low metabolism because of their inactivity and other things. So these myths should be busted.
As Sir said, I would like to add on to what Sir said, that extra food, extra junk food, like for example, if you add on 500 calories a day, so per week you add on around 3,500 calories, which is equivalent to gaining of half kg of weight gain. So this is the additional what we just think it's just 2 slices of bread or just a biscuit packet. But this adds on to your calories apart from all your meals together.
So doctor, what are the health problems associated with obesity?
Obesity, we look like that is a cosmetic issue. Somebody who is obese will feel like the other people are looking at them and physically they are just kindling them or something, whatever. They are not approachable. But the real factors which are associated with obesity are diabetes, high blood pressure, high cholesterol levels. Most of the people have the sleep apnea problem. They snore a lot in the night, and they have a fatty liver, which is very common. Do one scan, there are a lot of fat deposited in the liver. That is called a fatty liver. Apart from this, especially for ladies, they have the PCOD issues, menstrual irregularities, infertility issues, and both male and female have high risk for cancer. This is very much underestimated. Somebody who is obese is prone to get cancer, both male and female. So this awareness should be among the people. Some mechanical causes include this osteoarthritis, joint pain, back pain, which is because of the weight. Somebody who is supposed to be 50 kilos, if he is 100 kilos, is going to carry that extra 50 kilos, and the knee joint and the ankle joint is going to bear the weight. So the wear and tear of the joint will be on the faster side. Okay. So these are some of the commonest things which we see. The metabolic syndrome, which we always stress in a patient with obesity, is whenever somebody is obese, he is prone to get diabetes, that is insulin resistance. That is the main reason for this type 2 diabetes, high blood pressure, high cholesterol, and the risk for cardiac disease, heart attack and stroke risk will be more. Excess weight with any one of these problems is termed as metabolic syndrome. So whenever somebody it is easy to see their waist hip ratio, or calculate a BMI, body mass index, which is very easy to calculate. So whenever it is on the higher side, they should always approach a consultant, a nutritionist or a weight loss consultant to have a proper guidance. And approximate measure of this weight can be done like somebody who is having a height of 170 centimeter. Height in centimeter minus 100 should be their ideal body weight. So somebody is 170 centimeter, the ideal body weight is 170 minus 100, 70 kilo. If suppose they are going to be 10-15 kilos extra, it comes under overweight category. More than that, they will be in the obese category. These are rough measures. So always one should keep this in mind.
So you want to put some time?
Yeah, let's say for waist circumference. So when you say waist circumference, so waist circumference when it is above 72 and above 78 for males, females and males, they need to look carefully at their weight, stop gaining their weight. But yes, when they come above 80 for females and above 90 for males, they need to take and seek medical advice of a doctor as well as a dietitian.
So what is the best way to lose weight?
So losing weight, I'll take up this.
Yeah.
So losing weight is like people think it is very easy. It's not an easy job because of the lot of fad diets which are making headlines today. Losing weight, people taking the help of a qualified dietitian is not happening these days. So when we say weight loss, there are various diets for weight loss. So mostly it's like a low calorie diet or a low carbohydrate diet. So when you say it's a low calorie diet, they try to reduce all the macronutrients which is like carbohydrate, protein, fat. All these three macronutrients are reduced in them, and the calories approximately like 1000 to 1400. So that is the low calorie diet. We have the very low calorie also. So when it's very low calorie, it goes below 1000 calories. So it might be even 800 calories also. So when people follow this type of diet for losing weight, they need to seek a qualified dietitian, because when you are in such a low calorie diet, you can lead to nutritional deficiencies. And when you're reducing on your macronutrients, you have various issues like constipation. People may also go down on their vitamin D levels, on their calcium levels, on their B12 levels. So weight loss, when they say they have to, choose an appropriate diet which is for them, whether it's low calorie or low carbohydrate. When you say low carbohydrate, that means the fat goes very, very high. So it is around 150 grams or 200 grams. So such high fat diet. So when you do such kind of high fat diet, what happens? You might lose 10 kgs in 1 month, but again you gain back those 10 kgs. It's like a yo-yo effect. So these kinds of diet needs to be avoided, and a very high fiber and a normal protein and an adequately balanced diet according to their physical activity, how much they are doing, it needs to be done.
I would just like to add on,
Yes.
always in terms of overweight and obesity, is better to prevent rather than to treat. So always prevention is better. Somebody who is on a normal weight or something, always they should work hard to avoid weight gain. Suppose somebody is on the higher side, two things have to be addressed. One, as she said, diet. The other thing is the physical activity. Both are going to add on your metabolism. So ultimately, when the metabolism rate is on the higher side, we burn the calories. So we need to reset the metabolism to burn the calories. Somebody is extra 15 kilos. The 15 kilogram of fat is to be burnt. So, right, as she rightly said, the intake has to be, it is like a bank savings. So you have a savings account. So if you are going to spend your account, then only the money will go. And whatever income you are getting, you have to reduce the income. If you are going to have more income and if you are not spending much, then your account will be keep on adding. It is same with weight also. So she is going to reduce the calories. She is going to put you on a low calorie, high protein diet. And there are a lot of this paleo diet, keto diet, which from my perspective is not a scientifically right thing. because whatever we need a balanced thing for our body to perform. We need carbohydrates, we need fiber, we need proteins, we need fat. Cutting the carbohydrates totally is not advisable thing. So always when somebody is going to go on a diet, they have to seek a nutritionist advice or a weight loss consultant advice. Then only they have to go on a diet protocol. And simultaneously, they have to alter their activity also, physical activity also. They have to perform a physical activity according to their ability. So both these things will add together, and that will help to reset the metabolism and lose weight.
So when we say physical activity, people say we are walking for 1 hour, we don't lose weight. So it is the duration and intensity of the exercise which is important. If you do brisk walking 15 to 25 minutes, you're going to lose only 100 calories. The same thing, a homemaker might iron the clothes or wash the dishes. But if that is done for 45 to 50 minutes only, you will lose 100 calories. Even if it's, they say whole day we are climbing the steps and up and down, we are walking around, but we are not losing weight. So even if it's climbing the steps, it means you need to cover 30 per minute, and it's a 7-inch step. Which you do it for 10 minutes, you lose 100 calories. Even if you wash a car washing is 10 to 20 minutes, then you lose 100 kilocalories. Or just mopping a floor, again that needs to be done for half an hour. Then only you lose the 100 calories. So it depends upon the duration and the intensity of the exercise which you do. So you have to, when you want to increase the intensity and duration of the exercise, you need to take your doctor's advice before you put yourself into any kind of physical activity and exercise. Without knowing your health condition, do not put yourself into any kind of vigorous activity also.
The minimum requirement which I always suggest is walk 1 hour briskly. So brisk walk of 1 hour covering 10,000 steps in a day. That is the minimum requirement which we advise. Apart from diet, and they can additionally do whatever exercise they want according to their ability. This is the minimum requirement. So no point in walking for 1 hour with mobile in hand, scrolling, seeing something. It's not going to help in any way.
So does a low-calorie diet help in losing weight?
Yeah, as I said earlier, low calorie, yes, it does help in weight loss, but there is a duration till which you can follow a low calorie diet. I said it will lead to nutritional deficiencies. So it's just followed for a period of time for you to achieve a little bit of weight loss. So that is for a shorter duration of time. It cannot be followed for a longer duration of time. But when you want to follow it for a longer duration of time, that means you need to balance your diet, you need to increase your portion of fiber in the diet, at least fill half your plate with your fruits and vegetables, a quarter of your plate with your cereals, and quarter of your plate with your protein. And yes, you need your calcium through the curd also. So you have to do the portioning. With this, you can, lose around 2 kgs per month and in the long run. So you will not get back the yo-yo effect. You will not gain back the weight what you have lost when diet is adequately planned and done in a very good format. You will never get back the weight because the proteins would be adequate for you. If it's going to be on a fat diet, proteins might be low, fat might be high. So you will be losing your muscle strength. You will be feeling very, very tired. So your HB levels might go low. So all these are there, a part of a low calorie diet. So you need to follow it only for a period of a shorter duration.
What are the various classes in obesity?
Yeah, when we classify obesity, we say body mass index. Like Sir said, even for height also, height minus weight will be their actual weight. So similarly, we classify with the body mass index. So it is weight divided by height in meters square. So first, the WHO, according to WHO, for a normal individual, it's 18.5 to 23 would be the normal weight. And for Indians particularly, they have revised these guidelines. And in 2000, for Indians, it is particularly the 23 to 24.9 is called as overweight, and 25 to 29.9 becomes the pre-obese. And then 30 to 34.9 would be the class 1, followed by 35 to 39.9 is the class 2, and greater than 40 becomes the class 3 obesity.
So how to measure
Compared to
BMI?
this Western people, we have a different fat distribution. That is why WHO is classified for, especially for the Asia Pacific region. It's not only for Indians. The Asians have a different fat distribution. It's called Yui Paradox. Somebody, 30-year male, if you take from an US or UK, 30-year male from India, if you are going to do a body composition analysis, the percentage of fat distribution, we find our people are having more fat. The visceral fat is more compared to the Western population. They have more of proteins and muscle mass, but we have more of fat. That is why for our people, the BMI classification is little different. Actually, WHO for a person, BMI of more than 25 is called overweight. More than 30 is called obese. 35 is severe obese, and above 40 is class 3 obesity, morbid obesity. For us, Asia Pacific region, it's 2.5 less. Above 27.5 they are called obese. Above 32.5 it's severe obesity. Above 37.5 they are called morbidly obese. Okay, so the difference is because basically genetically the fat distribution and the risks for cardiac problems and the neurological problems is more. That is why we need to intervene early.
So how to measure like BMI?
Yes, BMI, as I told you, it's weight divided by height in meters square.
We take weight in kilogram as the
Kilograms.
numerator, height in meter square. Suppose it's 170 centimeter, we take 1.7 into 1.7, the denominator. You can put the height in the numerator. Whatever values we get, we plot.
Okay.
But sir, do we always look at BMI? We also look at other factors also.
Yeah, it's not only BMI, as she said, it's not only BMI. We need to take about the waist hip ratio. The body composition analysis will also give us the result, how much fat distribution is there, how much visceral adiposity is there. Some people may look thin, but the visceral adipose tissue will be more. So if we do a body composition analysis, we exactly get how much fat distribution is there inside the internal organs, surrounding the internal organs. This fat is going to secrete a chemical, like a hormone. So what nowadays, what we consider this fat stores it is as like an endocrine organ. These fat stores, like thyroid, like pituitary, like adrenal, the fat stores, these adipose tissues acting as an endocrine organ. For a normal person, it is releasing hormones called adipokines that is good for the body. It is going to keep the blood vessels relaxed, open, the blood flow will be more, the metabolism will be on the higher side. But for an obese person, the hormone secretion, entirely the nature of the secretion changes from these fat deposits. Same person who is the normal weight 70 kg is going to secrete some hormones which is going to keep him healthy. If he is going to put on weight, his own body is going to secrete the hormone which is going to be detrimental for him. He is going to collapse the blood vessels, the blood supply to the heart, lungs, brain, everything is going to come down. The blood pressure is going to rise. All these changes happen because of the hormones from the fat. So that is considered as an endocrine organ of late. So we are going to, we need that distribution of fat can be assessed through the body composition analysis. If it is going to be in excess in the internal organs, then we need to address that. Apart from BMI, waist hip ratio, this body composition, fat distribution is also must.
So next question, does COVID-19 increase the factor causing obesity?
Yeah, of course. After COVID, we are seeing a lot of patients who are put on weight. The thing is, there are a lot of physical restrictions in movement. So all these activities, physical activities, who are going for some gym or involving in some kind of sports activity, everything got restricted. So automatically the physical activity has come down, and unfortunately being at home the diet pattern has entirely changed. They are, if not junk food, but they have taken more of homemade foods on the higher side. The calorie intake is more. We are seeing a lot of patients who are put on weight 10 kilos, 15 kilos due to this pandemic. But if somebody is committed, definitely they can lose this weight.
So what causes obesity in children and youngsters?
In children, particularly for the past 2 years, as said, there was a sedentary, very sedentary lifestyle. They were not able to play outside of their home. So it was mostly their online classes which they had to attend throughout. So and the work given to them, that was also they had to do it through the online only. So the usage of the systems were more, screen time was more. So apart from this, even if they are for the leisure time, did not have any options except to log on to the screen time, and this has increased their weight. We have seen recent studies, all the recent studies, pre-COVID the children weight were less, post-COVID all the children were coming into the category of more than 95th percentile, and they were found to be a lot of obese.
The most important thing which we need to convey is we are number 2 in the world in having obese children. China is number 1. But what statistics says, what graph is showing is by 2030, India will be having most number of obese children among the other countries. When you compare to other countries, we will be having most number of obese children. This is not a good sign. Actually, obesity in children and adults is going to have significant detrimental effect. That is going to affect their moral, their psyche. The obese child may not have that much enthusiasm, and he is always laughed at, or he feels depressed. The intuition always says that he's been looked upon as a matter of jovial thing. So whenever they go out, they have that inhibition. The social inhibition will be there. So this always leads to a psychological thing in these children. So they generally don't mingle with other people. They don't involve in activities also. They don't go to a social thing. They restrict themselves. All these things also happen in adults. Okay. By 2030, and we will be the number 1 in the world, having most number of obese children. And this will definitely indirectly affect the society as a whole, because if you take another 15-20 years down the line, these children are going to form the predominant population in the society. Definitely this will have a huge impact on the socio-economic status and everything.
Even the health cost also.
Yeah, health cost, whatever we are going to, once a comorbidity is going to set in, the complications of diabetes is known to everyone. The complications from blood pressure is known to everyone. But the root cause is not known to everyone. That is the problem. They know diabetes will affect their heart, will affect their eyes, will affect their kidneys, will affect their nerves. All organs are affected from head to foot because of high blood sugar. High blood pressure is also going to affect every organ. But the problem is obesity is the root cause for these two in most of the people. But they are not addressing the root cause. That is the problem.
So, doctor, how to prevent obesity in children and youngsters?
Yes, obesity, yes, as sir said, might be if they are born obese, that is one thing. The another thing is by their lifestyle, they are obese. So for a normal child, it's a physical activity at least minimum of 1 hour. So if the child is going to be still more obese, then that physical activity needs to be increased, and yes, diet modification needs to be done for the child, where we need to increase their ratios of their decrease and increase the ratio of their macronutrients, as well as at least appropriate for their age what their requirements of micronutrients need to be met.
See, we have to prepare ourselves to say no to children. If you are going to restrict them from giving high calorie foods or something which they are very attracted towards, we should be prepared to say no. If you are going to buy these foods and we are going to feed them, definitely it will lead to weight gain. And the physical activity automatically will come down once they, because nowadays the iPads, laptops and mobile phones are the predominant thing which are used by the children, apart from outdoor activities. So automatically these are all not going to lead to any calorie spending. So automatically weight gain will be there. We should restrict the children from, see what commonly we say is, in the common places, we should not keep these kind of stuffs. Example, the dining table. Okay, they are going to open the fridge. This kind of stuff should not be visible in the first sight. If somebody is hungry, whatever is seen by them, that will be grabbed immediately. So if you are going to fill your plate, fill your table with healthy stuffs, so they are going to take that initially. All these things which we want to avoid should be kept under the healthy things. So if there are going to be 3-4 racks, it should be in the bottom of the rack. Okay. And if you are going to have a plate, always have a smaller plate and fill it with nutritious things so that your plate will also be full. You feel that you are eating more with nutritious things. Instead of, you are going to fill a smaller plate with rice, you feel that you have taken full plate of rice. But if your plate size is going to be big, and if you are going to put the same scoop of rice, it will not be filling. And psychologically, everyone will feel that they have eaten less. Even though they have eaten the same amount of rice, the plate size also matters. And the most important thing what they do, they either use the mobile phone or they watch TV, they watch some program, and they are going to keep on eating. They don't restrict themselves, and they don't assess how much calories they are taking. Suppose they are going to take 100 grams of rice or something, we don't stop at that stage because we are more concentrating on the screen or the mobile phone. So that is one thing we always ask them to avoid. You should not watch TV or a laptop or a mobile phone when you are eating, because you should concentrate on what you are eating. Then only you can restrict yourself or you can modify your diet. Okay. Then final thing is we are always addicted to these products we buy from the market, but we never see the label. It always mentions how much calories it contains, how much salt content is there, how much trans fat is there, but we never see the label. So always see the label before you buy some items.
And one more thing to add on, children don't eat mindfully, so they don't even chew their food.
Yeah.
They just gulp down their food. So when you gulp down the food, you feel hungry in another 1 hour. So mindful eating is they need to chew the food at least 10 times to get the nutritional value of the food as well as get the satisfaction that they have eaten the food. So not just gulping down the food. So we need them to help them to chew the food so many times.
So, like, how to manage obesity in children and youngsters?
Yeah, as we have discussed now that the diet as well as increasing their physical activity and reducing their screen time when they eat, let them eat with the concentration like Sir said. So even if you see a simple ad like a Cadbury ad, you see that person only looking at the chocolate, eating the chocolate, licking the chocolate. So her concentration is on her food. So similarly, we try to motivate the parents, we tell the parents, make the children focus on their plate, not on something else, so that they know what they are eating from it. And let them take time at least 10-20 minutes to chew the food and eat the food.
See, these high sugar containing cool drinks, milkshakes, ice creams, all these are like atom bombs. They have so much of calories in this. The sweets, if you take even a piece of sweet, you are going to take in so much of calories. Approximately equivalent to a lunch or a dinner thing. Okay, in one piece of sweet you can have that much calories. And to spend those calories, you have to increase your activity, but that nobody does. Suppose you are going to have a dessert. So we eat every time. The eating is a reflex for us. Morning, whether we are hungry or not, we take a breakfast and we have some snacks at 11 o'clock and we have a lunch and evening snack we have, then dinner, then post dinner we have a dessert. All these things are like a reflex. Whether we are hungry or not, we do these things. So always the calorie intake, we are never estimating how much we are eating. That is a problem. This applies to children also. We never estimate how much we are feeding them. We are always underestimate. What studies show is there is lot of discrepancy between what people say and what they actually consume. If you take this study is actually done, and this shows that people say that I have taken 1500 calories, but actually they have consumed 2500 calories in a day. This is what is happening. So we never estimate our calorie intake.
And when it is children, food can never be a reward for children. So when they do something good or something, we, get them a chocolate or something. So food is not a reward. So you just have, you have to change the way you reward your child. Spend some time with the child, or come, we'll have a game, we play a game. So that should be a different type of reward. Food can't be a reward for a child.
So I think my child is obese. What can I do?
Yeah, as we said, we have the CDC charts. So even if the parent Googles out in the Google, she will find the CDC chart. So she can plot her child's height and weight over there, and according to the percentile, as I said, 85th to 95th percentile is overweight, and more than 95th becomes an obese. So she has to know which criteria her child is coming into that, and what are the foods they have been eating. So what are the junk they have been eating? They need to consciously remove those junk food. Include a lot of fiber either through vegetables, at least minimum of 200 grams of vegetables per day, and a serving of fruit if they're feeling ill hungry. Fruit juices are not a replacement for a food. So when you make a juice, you discard the fiber. When you discard the fiber, you're discarding not only the fiber, you're discarding also the antioxidants which is along with the fiber. So you add a lot of sugar to it, you're just giving in empty calories. So a fruit has to be taken as a whole fruit and not as a juice. So what are the other sugars which they are including in, whether it's in direct form, as I said, biscuits, packets, it's just written for 100 calories. The whole meal pack may have around 15 biscuits. So one cookies itself will have so much of calories. So when the child is going to consume the whole pack, that means the whole meal is done. So they need to remove these junk foods, include a lot of vegetable, include a lot of fruit, and put according to their age group how much of protein requirements. Like for example, if it's a older child, it might be 50 grams of protein. So make sure their meal has the protein so that they have that satiety to the fiber as well as their proteins like their pulses or their non-vegetarian sources.
One thing we need to rule out in children is some underlying hormonic or genetic causes. So especially in children, we will also plot the height and weight. So if needed, we will do an endocrine workup for them. Some endocrine causes can be there in few children which can lead to obesity. But the commonest thing is because of lifestyle. And we should not miss this. So whenever your child, if you feel your child is obese, please consult a nutritionist or an endocrinologist or a weight loss consultant, so that we can guide you. If needed, we will do the proper endocrine workup and we will rule out other hormonal causes.
So what are the treatment options for obesity?
As I said, prevention is always better. But if somebody is going to be, we classify this overweight, obesity, and treatment options basically revolve around this classification. When somebody is overweight and class 1 obese, mild obesity, up to a BMI of 32.5 for Asia Pacific people, your body will respond. Whatever you do some activities, you are going to lose weight. You cut your calories, you change your diet, you are going to lose weight. So till BMI of 32.5 or maximum 35, your body will respond well. So you can definitely go for a diet modification, and then you can increase your physical activity. So non-surgical weight loss will be the predominant thing in these people. But when you are going to cross a limit, you are going to cross that line, Lakshman Rekha, you are going to come on the other side, you are going to be severe obese or morbidly obese, and if you are going to have some comorbidities like diabetes or hypertension, then definitely some kind of intervention will be required for these people, because what happens is weight is managed by a center in the brain. It's called a weight management center. It is in the hypothalamus region in the brain. Whatever diet we take, whatever activities we do, whatever fat stores we have, everything is going to give inputs to this center, and that is going to set a point for each individual. Suppose for somebody his weight has been set at 100, and whatever efforts he take, the weight will be fluctuating between 95 kilos and 105 kilos, but the average will be 100. So we have to reset this point. once the body resets this point, then only somebody can lose weight beyond this range. He wants to lose 25 kilos, this center has to reset the point. That doesn't happen for a person who is 35 kilos or 40 kilos extra above his normal weight. So for these kind of people, the metabolism itself will be on the very low threshold level. It will not, it's like almost dead. So whatever they eat, even one idli they take in a whole day, that calorie is going to get stored as fat. The metabolism on the lower side. This hypothalamus center has to be reset by a metabolic procedure. So that depends on patient to patient basis. When somebody is crossing that line, we also have some kind of endoscopic therapies for few people. We can put a balloon inside the stomach. That will help few people to reduce the weight once they are morbidly obese. Say 35-40 kilos extra for their weight, for their height. Then they need a metabolic correction. We do a keyhole procedure to change the metabolism. That will give an excellent result.
So, but for children, for example, like
Yeah.
you say bariatric surgeries, adults you classify as above 30, and if it's an uncontrolled diabetes also we can do it like that. But for children, as you said, if there is some kind of Cushing's disease or where you have to do a bariatric procedure, where can we go forward with that?
Yeah, if whatever medically needs to be corrected in an endocrine cause, we need to do that first. And then we follow them up. If needed, because once the weight gain, they need to lose that extra weight. If it is not possible, then metabolic procedure is an option for children. What guideline says, we have to wait up to 15 years in children. That is what the guideline says. So it's after 15 years you can opt doing a metabolic procedure. But we have some kind of syndromes where children are going to eat, or like Prader-Willi syndrome is there, where they have hyperphagia. They cannot control their eating. So they keep on eating, and 4 years, 5 years, a boy will be 50 kilos, 80 kilos, 100 kilos. In these kind of children, definitely a surgery will help. We have done metabolic procedure for the children who is having this kind of normal syndromes. So we need to, that is what I said, in a children, we need to look for the cause, whether it's a syndrome or it's an endocrine cause, it's a hormonal cause, or it's a genetic cause, or it is a lifestyle thing. So then only we can decide upon the treatment.
But I think that decision needs to be taken very quickly by the parents, whether to analyze, whether it's a dietary, lifestyle related or a hormone related, where they need to seek the medical help, and then it could be, help them earlier than them going into any kind of complications.
So, are there surgical options for the treatment of obesity?
Yes, I said that surgery is the last resort. That is not an option for everyone who feels they are obese. Someone can feel they are obese, they can think they are obese, but we need to actually see them, how much weight they are actually on the higher side. Then we decide on the treatment. If they are going to, they are unable to lose weight on their own, in spite of doing a good amount of exercise and proper dieting, then definitely metabolic surgery is the option, is the best option available.
So can we do it even for persons who have uncontrolled BMI and their BMI is lesser than 30?
Yeah, that is the concept of metabolic surgery, because when the bariatric surgery started initially, then the patient lost weight, and during the follow-up we found that they are becoming euglycemic. The diabetes is getting reversed, the blood pressure is coming under control, cholesterol is getting reversed, the sleep apnea is gone, the PCOD is reversed. All these comorbidities are getting reversed. That is the beauty of this metabolic surgery. So initially what started as a weight loss procedure is now we are traveling a different paradigm. We are not doing for weight loss alone for these people. Somebody who wants to lose, who wants to get their diabetes under control, who wants to get rid of their medication, definitely this bariatric metabolic surgery is an option for them. So there are guidelines, as you said, for a BMI of 30, if diabetes is not under control, definitely metabolic surgery is going to help them. That is what guidelines is. Above 35 BMI or severe obesity for Indians, above 32.5 BMI, it is a direct indication. If somebody is going to be obese, diabetic, hypertensive, it is a direct indication to undergo metabolic surgeries, which will get rid of their diabetes and hypertension. The beauty of this is weight loss will happen over a period of 1 year. You do a surgery for a patient who is 150 kg, and he needs to come down to 70 kg. It will take 1 year. But from the next day, his blood sugars will come under control. As I said, everything is hormone mediated. From day one, if you check his blood sugar, it is going to come under control. His blood pressure is going to come under control. So that is where the concept of metabolic surgery rose.
When thinking of obese people, they are also psychologically very well affected. So
Yes.
even the stretch marks which they get, whether it's on the buttocks or the abdomen, they are very, very depressed. It also leads to a cosmetic problem for them.
Yeah.
And of course, they need a lot of help. It's not only diet and the procedure. I think psychology plays a very important
Definitely.
role where they
Definitely.
need a multidisciplinary team to, handhold them
Definitely.
and help them through the weight loss.
There are 4 different reasons why people come to us for weight loss. See, the teenage people usually come because they want to look well, they want to look beautiful, and somebody or in the verge of getting married, so they are in those familial process. So that is one group of people, but that is only 10 to 20%. Predominantly, people come because they have diabetes or hypertension and they are obese. So these two things are got rid of, and as I said, all these comorbidities are getting resolved. So these are the predominant group of people. Say 60%, 70% of the work is for these people. There are people who are above 60 years who come because they are not able to manage themselves. They want to depend on others for even to go to a restroom. So the quality of life is severely compromised. The joint pain, the weight, they are not able to move around. They need support always. So this is a group of people who come to us because they want a good quality of life. They are not mindful of their diabetes or taking one more pill extra is not going to affect them. And there are the 4th dimension, which as we said, those who are depressed, those who are psychologically affected, because if they go to a public place, they cannot use a chair which is commonly, if they go to the airport chair may not be sufficient for them. And if they go to a restroom, that may not be a comfortable one for them. And they cannot try all these new apparels. So everywhere they have restrictions for it, because there are few showrooms which are going to sell them XXL size dresses. Okay, so social stigma is there. Even there are a lot of people who have lost their job because even when the common mindset among people is when somebody is obese, he is a lazy person. Of course they are not. They can even work well better than us. But still, the common mindset is somebody is obese, he is a lazy person. So many people have lost their jobs at the interview level because they are obese, and they have come to us. They have lost weight after a surgery. So we have different dimensions why we do a surgery.
So, as I said, obesity becomes a multifactorial disease. It's just not beyond diet. Beyond diet, yes, beyond hormonal issues, they have psychosocial problems. Even the environment also contributes to it. The epigenetics contribute to it. So, you say it's a multifactorial one. So, you don't just categorize obese people and say it's just only because of the food they eat. So, it's just beyond even diet also.
So, doctors, we are getting some few questions from our viewers.
Yeah.
So the first question, one of my relatives' son looks overweight. Don't they that? How to differ? But the whole family looks like that only. So I feel it's genetic issues. Do we have any solution for this type of overweight or obese?
Yes, I need to stress this one point here. As she said, epigenetics. Somebody who is obese and they are going to bear children, the child is going to be obese. This is proven. But if they are going to lose weight and they are going to have a children, the child will be of normal weight. That is the importance of losing weight before you get pregnant, because automatically this genetic obesity gene is carried to the next generation. Basically, by default, all human beings are prone to become obese. That is the gene we possess. Okay. Whatever genetically we possess is a obese gene, obese kind of gene only. What happens in a environment like where we do more of physical activities, this gene is being suppressed. So our physique will look like a normal thing. But whenever this physical activity is not there and we have food in excess, then that genetic thing is going to express itself. It can happen to me, it can happen to anyone who is going to change this metabolism. So it is something genetics plus the lifestyle plus the environment which is going to influence. As we said, the epigenetics, that is not common in other diseases. Epigenetics is very common in obesity. It's not only your gene, everyone has the gene to become obese. But fortunately, some people are not obese. That is what I should say. Because of their lifestyle, because of their diet and other things. Once the environment and these things are going to change, automatically everyone can become obese at any point of their life. So for that boy or girl, probably is familiar. The parents are obese, the child is automatically obese. But the risk and complications and comorbidities of obesity will be there for both for the parents and children. It's better to have a consultation and then decide what we can do.
The next question, because of too much work pressure, I don't get time to exercise. What should I do?
The stress also is a causative factor for obesity. So when you're stressed, you eat more. It's emotional eating again. So you can't say you don't have time. You need to emphasize. You need to give some time for yourself. As I say, I don't advise people to go to a gym, do an aerobics or something. I just tell them even a simple march past. You are watching a TV or watching your home serial. Just have your shoes, sports shoes, what you need, and do your march past like a soldier at least for 40 minutes. That will make a difference even if you make it do it 3 times a week. At least minimum the area suggests 150 minutes per week. So if you are able to spend that much time, that's more than enough.
The emotional eating, as she said, studies have clearly proven that the same calorie which we are going to take during a happy moment and the same calorie which we are going to take during a stressful moment, sad moment, will be added to our body in a different way. If you are happy, the calorie absorption is much less. And when somebody is stressed, it's stress here is not physical stress, it's a psychological stress. Then it leads to emotional eating. The same 200 calories which they are going to take is going to add to the body as fat. So somebody who is having emotional eating or stressful eating definitely will put on weight. That is proven beyond doubt. There is one more thing which apart from the stressful thing, the circadian rhythm, what we say. See, our body is tuned to sleep in the night and be awake in the daytime. That is what most of the animals and birds will be doing. So we are designed like that. We are of course a social animal, so we are also designed like that. But unfortunately, most of the people who work in night shifts, so they are going to entirely go against the biology, against science. So we are working against science. So automatically the circadian rhythm gets altered. Once you are not going to sleep properly in the night, weight gain will be there. If you are going to, because and the one more thing which people commonly do during long hours of working, sitting in a places, they keep on eating something, some snacks. See, without their knowledge, they are just going to grab these chips. Some kind of snacks they are going to eat. They are going to have a sip of the coffee or cool drinks. So we don't estimate the calorie intake. This is called nibbling or whatever. So there are a lot of food deviation in the patients. that is also going to lead to this weight thing. So we should not affect, the stressful eating is most important thing. That is one kind of deviation from the normal eating behavior. And some people eat, it's called binge eating. They eat more. Whenever they get a good food, they eat more and they go and vomit. They voluntarily they want to vomit. See, that is one thing they do. And it's called night eating syndrome. Some people wake up in the middle of the night and go and eat because they feel hungry at 2 a.m., 3 a.m. After they go to sleep, they wake up in the middle of the night and they are going to eat more. These are different kinds of patterns which we see among patients.
Okay. So, what is the ideal food for dinner to lose weight?
Ideal food, you cannot say, but at least a proper proportion of your 3 meals where you need to distribute. But when you have a dinner, it should be a light one. And yes, of course, the sleeping pattern between your dinner and sleep at least a minimum of 2 hours.
One thing we need to stress here is fasting is not the correct way to lose weight. So if you want to lose weight, do not fast. If you are going to fast in the breakfast or in the dinner time, that is not the right way to lose weight. What happens when you fast is your proteins are getting broken down. Your fat is not getting lost. Your fat is stored. Your proteins are broken down and you lose weight up to 10 kilos, 15 kilos till as she said, there's a yo-yo phenomenon. Till few days, few months you keep on losing weight because you lose proteins. And once there is a plateau beyond which you will not lose weight. Because body cannot it's not supposed to break more of proteins after that point. And people get frustrated, they start eating normally and what they put on is fat. Once they start eating after that, it will be added as fat and it will lead to weight regain. This is what is called yo-yo phenomenon. So never fast. So always you have to take something which is rich in proteins. It's better if you want to have an ideal dinner, you have more of proteins in the night, less of carbohydrates, less of fat.
Okay. So another question, sir, how come drinking more water for weight reduce?
See, hydration is one of the things which is going to help in sustaining this metabolism. That is, drinking more water alone is not going to cause lose weight. In that case, it will be easy for everyone to lose weight. They can eat more, they can drink more water and lose weight. But hydration is one. If you see the food pyramid, the base is this liquids. You take see 10 glasses, 12 glasses of liquid. That is the base of the food pyramid. And above it comes the carbohydrates. Above it comes the proteins, and above it comes the fat and oils. So the base is always fluid. That is the proper food pyramid. So in that way it will help.
As I said, water is vital for every individual. But when you say water, it can't be, you can't say it's 2 liter exactly, it's 4 liter exactly. Each one's physical activity is different. One might just sit at a system and work. So for them, water consumption would not be more. But once a person works out more or he's in the sun more, where his sweat is more, his perspiration is more, his water intake needs to be added to more. So it cannot that one person needs to have 4 liters at one stretch the whole day. It also depends on his weight. So for example, a 50 kg individual just without not working out or just at the system might require 2 or 2.5 liters of water. But when the workout is there, when there is a lot of expenditure, then the water consumption needs to be increased.
So, do you agree that high carbohydrate diet may make you fat?
Of course, if you are going to take extra calories for your weight, then definitely it will be stored as. If you are going to spend it, it will not be stored. See, eating alone is not. You have to spend the calories. If you are not going to spend that, it cannot be stored as sugar. There is a limit for storage of sugar. Carbohydrate is nothing but sugar. But fat, there is no limit. Sky is the limit. So it will be stored as fat.
Okay. So, what is the proton of fat we should have every day?
Every day it would just be around 30 grams of fat a day. But you have visible as well as invisible fat. So I'm just telling you about the visible fat. So invisible is present in all the foods. So that's why you have to keep your visible to minimal. Invisible will add on more. So you can imagine how much of fat you have been taking in the whole day throughout.
Yes. You can mention about the invisible fat.
Yeah. Invisible fat, for example, if you are taking an egg, so it does have one egg, at least it will have 6 grams of fat, 6.5 grams of fat. So that much of fat you are not counting into your daily diet. It's only the oil which you use you think is the fat. It's all also, if it's a cereal, it's a minimum amount of fat. But we ask you to take good fat from your nuts particularly, because you have a lot of omega-3 and the other MOFAs in them also. But still, fat needs to be kept only around 25 to 30% of calories, protein 15 to 20% of your calories, and your carbohydrates 55 to 50% of your calories. So that's how you can't go high carbohydrate or high protein or high fat. You need to balance it.
Doctor, you want to say something?
No.
Yes.
You go ahead.
Thank you so much, Doctor, for coming for the live sessions. Thank you, viewers. Thank
I
you so
just
much.
We can end up the session.
Yeah. So what we need to convey here is obesity is not a cosmetic issue. First thing you need to understand, having extra fat is not something related to beauty alone. There are a lot of comorbid illnesses associated with obesity, and we need to be aware of that. Okay. What actually is happening is, everyone knows smoking causes cancer, smoking is a killer, but obesity is one of the reasons for cancer, as I said. And obesity is slowly overtaking smoking as the leading cause of cancer. So if you see 5 years, 10 years down the line, nobody will be talking about smoking as a leading cause of cancer. It is going to be obesity which is going to be the leading cause of cancer. It's almost overtaken smoking. So that the severity is that much. So always better to prevent from becoming overweight or obese. If you are on the early stage, it's better to act immediately. The current theme for Obesity Day is everyone should act. That is the current theme for this year's WHO theme for obesity. Everyone should act. It's not late. If you are going to be on the overweight category, of course you are gifted. You can act by yourself and you can reduce your weight. If you are going to be on the higher side, okay. There are options. There are multiple options, and metabolic surgery is the last option. But it is not. A sin or something which should not be done. See, many people think that only this can be this procedure is done by celebrities. Only they can get it done, and some VIPs. It's not like that. Even common people are getting it done, and many people are coming out and spreading the awareness to others. And surgery, there is always a stigma that surgery is something which is going to put them into rest. They are going to be bedridden for so many days. It's not like that. It's a keyhole procedure which is hardly going to take an hour or two. Once after 2 hours, they are going to walk back to their room. And next day, the people are fit for discharge. So 24 to 48 hours, they are fit for discharge. So what we say, you spare a weekend with us. It's called weekend weight loss surgery. So Friday we do the procedure. By Monday, they are fit to go to their work. So they won't have any pain. There are no scars. And of course, the weight loss will start immediately. The comorbidities, they're going to leave the comorbidities in the hospital itself. They come with the diabetes or hypertension and they go back, they are normal. So this is the scientific advance which we are having. And it's extremely safe. It's 500% safe, beyond what they think. So that needs to be the last resort.
So it's to wind up to say, do not look upon obese people. You need to help them out to lose their weight. They do go through a lot of psychological issues. So as healthcare workers, we need to help them out. So
everyone should act. That is our thing. Whether if somebody is obese, he should act. Otherwise, somebody surrounding them should act.
Should help them out.
Thank you, doctor. Thank you so much
Thank
for
you.
giving a lot
Thanks.
of information to us viewers. Thank you.